Major depressive disorder is a disorder that affects everyday life by causing a persistent feeling of sadness. It has been classified by the DSM-5 as a depressive disorder, which in the previous DSM-4 was originally classified under bipolar and related disorders. This disorder is often described by episodes that will last for at least 2 weeks long, but will often last longer and will often reoccur in a person's lifetime. This disorder needs to fulfill certain requirements to become classified as major depressive disorder that are shown in the DSM-5, such as depressed mood most of the day, almost every day, and feelings of worthlessness. Throughout studies of patients with major depressive disorder, it has been suggested that the dorsolateral prefrontal cortex is a main facilitator in the brain for major depressive disorder, and this is often where TDCS will be focused on. This area of the brain has been linked to cognitive functions, working memory, and switching attention. There has been evidence found in previous studies that have shown the use of rTMS over the left dorsolateral prefrontal cortex as an effective treatment of depression. Multiple studies have found the dorsolateral prefrontal cortex region to be linked to major depressive disorder through scans and testing. This area of the brain is also known to change in recovery from depression. There are options for treatment of major depressive disorder that might include medication and talk therapies, and in more severe cases where medication and therapy has not helped, transcranial direct current stimulation, or TDCS, is the next viable option. TDCS is a non-invasive technique that uses weak direct current stimulation through the cerebral cortex by 2 scalp electrodes, an anode and cathode, that allow to go deeper into the regions of the brain compared to rTMS. Anodal TDCS enhances cortical excitability and induces neuronal depolarization, while cathodal TDCS reduces cortical excitability and leads to neuronal hyperpolarization. TDCS cortical excitability can last for hours after the end of the stimulation treatment, meaning it could be a promising treatment option for a disorder like major depressive disorder. Often the anodal stimulation will occur on the dorsolateral prefrontal cortex. This treatment has led to improvements in cognitive abilities in patients with major depression. In a study conducted in 2009, showed that on a study of 14 hospitalized patients that were not improving with medication and had a high risk of suicide completed 20-minute treatments of TDCS over a 5-day period. This study found that the Beck Depression Inventory and the Hamilton Depression Rating Scale improved by more than 30% after 5 days of treatment. This mood improvement continued and even increased 4 weeks after the treatment ended. This study shows the promising applicability of TDCS for those with major depressive disorder. Other similar studies have shown similar results that testing cognitive abilities before and after TDCS showed improvements after the sessions. There have been multiple pilot studies conducted regarding the effect of transcranial direct current stimulation on major depressive disorder that have shown to have improvements in patient scores. Often these studies will have a small sample size of patients that will undergo certain amounts of TDCS treatments, lasting anywhere from 5 to 30 minutes in length. TDCS has been looked at as a good option for those who have major depression where medication is not helping. Although there have been studies to show the positive effects of TDCS on major depressive disorder, there has not been enough studies with larger sample sizes and follow-up evidence to completely prove the effectiveness of TDCS on depression. A sham versus active TDCS study showed results of active TDCS being superior. However, the role of TDCS is still being questioned as there are still further studies to be conducted. Further studies using larger sample sizes would be needed as evidence for the strength of TDCS as a treatment option, as the sample sizes in previous studies have been small. Another effect of TDCS to look at is the long-term effects on depression. The effects can last up to hours and even days or weeks after treatment is complete. However, we want to prove the effectiveness as a treatment after months or even years after the treatment is complete. Overall studies that have been conducted show results of the positive effect of TDCS. There is further research to be done into this field into the lasting effects of treatment, and using larger sample sizes specifically determine the positive effects. Thank you.